What are the risks of Botox?
Botox, or botulinum toxin injection for aesthetic purposes, has been the most popular non-surgical cosmetic medical procedure in the world for years. In the United States, the other botulinum toxins available to us are Dysport and Xeomin. As one of the first doctors to use botulinum toxin in 1993, before it was used for cosmetic indications, I can discuss my experience and how I counsel my patients about the risks of botulinum toxin in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As I mentioned earlier, as an oculoplastic surgeon, I was among the first group of doctors to administer Botox to patients for the treatment of neurologic conditions like hemifacial spasm and benign essential blepharospasm. In fact, I was a division chief at a hospital soon after my fellowship training, and I was the only one at the hospital allowed to use botulinum toxin. If other doctors at the hospital wanted to use botulinum toxin, they had to contact me and to present their request, and it was up to me to approve their use of Botox. At the time, I was so focused on the numerous medical and neurologic uses of Botox, I questioned how it would be possible that people would willingly subject themselves to having a neurotoxin responsible for paralysis and death, as in the case of botulism, for the purpose of improving wrinkles. Clearly, the world has more than embraced botulinum toxin for aesthetic purposes. The applications of botulinum toxin for facial enhancement and even underarm sweating are very well established. Botulinum toxin is not a filler. It works by interfering with nerve signals that go to muscles. By blocking the nerve signal, the muscle doesn't contract. For example, in a situation where you have deep frown lines, the muscles responsible for these lines are the corrugator and procerus muscles. After botulinum toxin is administered, the lines are diminished since the muscles are not as active. This effect can last about 3 to 6 months. In my practice, I typically treat people every 4 months. The more common concern I address is a fear of looking overdone. This concern is usually followed by the recitation of a list of famous people who the patient says looks Botoxed or frozen. As with any facial enhancement evaluation, I discuss the potential role of botulinum toxin in the context of other issues which are typically present, such as hooded upper eyelids and under-eye bags, cheek volume loss, and thinning lips. I show examples of area-specific treatments such as crow's feet lines, frown lines, depressed brows, and downturned lips. The effects of botulinum toxin are generally seen at 3 days and peak at about 2 weeks. My patients don't look frozen or fake. They just look better. Since I see my patients routinely 2 weeks after injectables, I assure them that I can start conservatively to see how they respond. As with any procedure which involves needles, there are some people who have more anxiety about needles than they do about the outcomes of treatment. I offer my patients topical anesthetic as well as nitrous oxide sedation so they can be more comfortable. People are able to drive after receiving nitrous oxide sedation, which is commonly used for dental procedures. I also use the smallest needles, and my technique has been consistently successful in terms of patient comfort. Asymmetries in botulinum toxin affecting non-targeted muscles inadvertently is a risk. Asymmetries such as uneven brows can be addressed with additional placement of botulinum toxin to create a better balance. Sometimes a facial muscle can be affected, such as in the upper eyelid, resulting in temporary mild ptosis. Since the botulinum toxin was not directly placed in this area, the effect is caused by a relatively low dose, which means the muscle activity typically returns much sooner than the intentionally treated muscles. Problems with botulinum toxin and other fillers are often associated with people thinking that cheap Botox or fillers is a good idea. Understanding the minimum cost to the practitioner, it's obvious that a lot of the typical low-cost botulinum toxin is delivered by over-dilution of the product, so the effects don't last as long as they should. Instead of calling it cheap Botox, it is often referred to as expensive water. On a more serious note, the product is as good as the practitioner performing the procedure. Knowing the muscular anatomy and understanding how to precisely dose and place is truly an art, which takes years to develop. You can decide how much your facial appearance is worth investing in. I think that I can state from my personal experience that the risks of botulinum toxin can be minimized by having the procedures performed by an experienced physician in an office setting who will be there for you should something unexpected occur. I hope you found this information helpful. Thank you for your question.